So tell us more about a little bit about the survivorship program, because you do have it at the Miami Cancer Institute, and I think that's important to know.
Yeah, sure. So certainly a lot of the referrals come from the survivorship program. The survivorship program typically focuses on quality of life care after a patient has successfully completed cancer treatment. Of course, as we talked about, the ability to have a family is one of those things that's really important to our cancer patients as they live longer past their diagnosis and look forward to the future. So as we discussed, it's not always appropriate for a patient to preserve fertility prior to their cancer treatment. They must be healthy enough, and their cancer can't be one in which is very aggressively growing or has spread to different parts of the body, right? So a lot of cancer survivors are looking to answer questions such as, is my fertility affected after my cancer treatment?
Absolutely.
When is it safe to become pregnant? How likely am I to become pregnant? Or various questions about the safety of pregnancy in general after cancer. So it's a great program. They focus on all quality of life care after cancer treatment, and truly, I think the focus needs to be, greatly emphasized, I think, from the beginning, but, of course, case-by-case situations don't allow for such things. So survivors we truly kind of embrace them and help them in whatever capacity we can.
An eye-opening conversation on fertility preservation, that's definitely for sure. Dr. Diaz, any message that you want to get across to our viewers, or those listening out there, about fertility preservation, about this kind of treatment, and your work with the Miami Cancer Institute?
Yeah. I think the important message we tried to get across today was that cancer can be a devastating diagnosis. However, it's not the end. And work with your oncologist, and if they haven't brought up the topic of fertility or future fertility, it's something that the patient should bring up and be their own advocate. And you will find many oncologists are very welcoming to this discussion and will guide you through this process. And so it's important to think of not only overcoming this initial cancer diagnosis, but life after cancer.